So welcome everyone, this is the Fibromyalgia and Chronic Pain group. Here we have myself and Marianne from Doncaster, and we've also got Kerry Davis as well from IAPT, who's going to go through a couple of methods for you. So I'll hand over to Kerry.
Hello, I hope you're all doing all right. So I work for IAPT long-term conditions. I'm not sure if I've met any of you looking at the education side of IAPT for fibromyalgia. If we haven't and you wanted to do that, then it's only a call to IAPT long-term conditions, and we offer a 2-session education group. I'm sure my colleague David mentioned this, but for anybody who weren't part of that meeting, you would just need to ring up and refer into service. That's the 01302 566 999 number. And if you just wanted to come in and just do the education, then you would be welcome to do that. So what I'm going to talk to you about is some of the techniques that we use in the education group, really about how you manage your condition. So I think first and foremost, please interrupt me if you want to say anything. Just give me a signal and give me a hand or something like that, and I'll stop talking. But the first thing that I think is the most important thing to say is, well done for being here, because it takes a lot in terms of having to prove that you're unwell to get to this point. And I don't know whether any of you have had to battle that to get to a point of getting a diagnosis and even actually being validated by people around you, so that sometimes our family, the people close by, are not always cooperative in knowing we've got this condition and kind of working with it with you. So it makes it incredibly difficult. So the topic I'm talking to you about is pacing. And I think it's so important to just mention, other people's reactions to you, because it stops your ability to pace. So quite often, if you think about it, when you have fibromyalgia, you might be the type of person, if people are not validating your experience, you might be the type of person who's having to prove yourself constantly to your family or friends around you, saying, I can cope, I keep going, because people are not acceptant of what you're dealing with. How can you become acceptant to what you've got if you're battling with everybody to get a diagnosis and to prove it, and then actually people are still saying, no, you need to check yourself, you need to get on with it? It's not the answer. And what it does is it lowers our self-esteem. So the first thing is that this is real. What you experience with fibromyalgia is real. And actually, nobody knows that more than you. And this affects many, many people in lots of different ways. So this is why it's so hard to pinpoint, and you end up having every test known to man before you get the diagnosis. So I think we are, as a society, trying to improve getting the diagnosis for people. And that's been a work in progress, really, and still is. But it's very difficult. So the fight of this means that I'm having to keep going, and I therefore don't necessarily pace. I don't learn how to pace. Now, the other thing in this is, quite often you might get, people tearing strips off you, saying you should be doing this, you should be doing that, you're useless, you're no good. And a lot of that will be impacting on your confidence, your self-esteem. So the opinion you hold of yourself will be on the floor if you're listening to that, or potentially could be. And the other thing in that is that people don't necessarily want you to be any different to how you've usually been, because quite often people with fibromyalgia tend to be people pleasers. So I make a really wide comment there, and forgive me if you're not a people pleaser, but quite often the patients I'm meeting are people pleasers. So you're very happy to do for other people. Now, people won't want you to change because they quite like having you the way they've got you, so it makes sense. But what that does at this point is that people will fight your eyeballs out for you not to change, for you to keep going beyond your pacing levels, beyond your health levels. So just bear that in mind when we're looking at pacing, because it's very hard, and we can't underestimate how difficult it is to make some of these changes, not only because you've got to do it, but because for some people, you've got the constraints around you of all the people who are fighting against you. Yeah. So I don't know if anybody can link in with that. If you give me, yeah, oh, that's good. I can see you nodding. So that's one thing. The other side to this is that if we think about low mood is to be depressed, it's to be overwhelmed. And a diagnosis of any kind regarding our health is overwhelming because it's a change of who we used to be. Yeah, so if you think about it, we've always been able to do the things we've done, and all of a sudden a health condition comes in and it kind of takes us away from who we are, what we know as being our reality. And it's very hard to change that. So we might be fighting the condition ourselves without realising it, or even realising it. Yeah, we might know we're doing it. And that's because we quite like who we were, thank you very much. And how dare you come in and take this from me? How dare you take my health from me? So if we're looking at fibromyalgia as the enemy, and that actually this is causing me problems, we're not always acceptant of allowing it in and actually working with it to pace with it. So I just want you to ask yourselves, are you letting this in? Yeah, are people around you stopping you allowing it in? And actually, does it overwhelm you? Is there some element of depression coming in? Because remember, for IAPT long-term conditions, we're here to support any anxiety, any depression, any panic, fears, phobias, all linked to this condition. The other thing is, the anxiety is the future focus worry. So whereas depression looks back, if only life were like it used to be, the anxiety side of it makes us worry about what's coming next. So what if I can't cope? What if I wake up tomorrow and I'm in a flare-up? What if I can't cope in front of my family? What if people see that there's something wrong? So sometimes we spend a lot of time hiding what's going on, and the anxiety of the fear of what's coming next can really exacerbate the flare-ups and the symptoms. And within that, within anxiety, the more anxious we get, the more we overbreathe. So anxiety, believe it or not, is a protection mode, and it's our body wanting to do something to protect you. So it's alerting you to there's a problem. I don't know if anybody gets eczema or anything like that, but anxiety plays its way out of your body. So it'll give you a skin condition to say, listen to me, you're not listening to me. And it irritates you. It irritates your skin until you listen. So it's kind of, fibromyalgia is very similar in that it plays its way out of your body to get your attention. Yeah. So if you think about anxiety as a protection mode, it's warning you and saying, oh, please, come on, let's look at this. We need to work with this because I'm worrying for future, what's coming next. And that in turn impacts your breathing. So I don't know if any of you feel breathless from time to time. It's what it's doing is the more in anxiety mode we get, the more in fight or flight we get. Yes, it's fight or flight. We either fight a situation or we run from it. But we need oxygen to be able to fight or flight. Yeah, run or fight. So our body knows to overbreathe to give us what it needs, but quite often the difference here is we're fighting ourselves. We're not running from anything other than ourselves. So we're not physically moving. We're stuck with all that extra over breathing to give us the power to run or fight. So there we lead into panic. So we have a knock-on effect where, without meaning to, we can get quite overwhelmed by a situation and in low mood, leading into worrying about what's coming next, ruminating about what we've lost, and then actually can feel quite panicky. And the whole thing feeds a cycle of being overwhelmed. So again, that can stop us in our tracks. And then to add on to that, if you think about your values and beliefs of who you are and what's been important to you through your life. So if you're the type of person who has always been a worker, yeah, you're the type of person who's always been family orientated, the things that really matter to you, suddenly you're in a position where fibromyalgia may well have impacted how you operate with that. So it may no longer be able to work. So there's a loss of identity in that. So when fibromyalgia strikes, it kind of gives you a loss of identity. Well, who am I then with this condition? You know, so it makes you really question. And we might like who we were before, as I've already said. So therefore, we're going to battle with who we are now, with the condition. If you think about how it might impact you with your family, if you're hiding the condition from your family or you don't feel validated, we can no longer be who we were. So it's a bit of an odd situation. We're trying to fight to be perhaps you're the head of the family and everyone comes to you for support. And all of a sudden, you've not got the ability to be that person giving the support. It can really massively impact us. So fibromyalgia plays a massive part in anxiety, depression, panic, fears, as I said, the phobias, and it can actually impact our values, our beliefs, the things that matter to us. So We can't underestimate what you're dealing with. Now, all of that has a massive impact then on how you manage the condition. So if you think about someone who's pacing, I'm just going to give you an example. If you think about an elderly person crossing the road, what they tend to do is an elderly person crossing the road would cross, and you might be driving your car and you're thinking, what have they crossed for? They're never going to make it. What's happening with that person is they're not accepting that their body is older than what their mind is. Yeah, so the mind still thinks they can get across the road. The body can't make that journey quick enough. And we're sat in car tooting almost. Come on, what you doing? What you doing? And this is a little bit like what you're dealing with, in that your mind is active and ready to go, but your body won't allow it at the minute. And what we do is we fight it to keep going. So what we've got to ask you to do, and this is very difficult, what I'm asking, especially in an environment where you're a busy person, we have to stop for a minute. Now, stopping means we've got to face the situation. So we've got to be ready to do that, and we've got to nurture that process, because that's not easy for anyone. So stopping and looking at this, and it feels like you're all ready to do that in being in this room, in this group, kind of, you know, listening in and wanting more information. But the more we stop and we're looking and we say, right, what do I need to do? The more your body knows that you're trying to work with it. So the basics of pacing is that what we have to do is to identify, we've all got a baseline, yeah? So we've all got a baseline of what our pain would be in the morning. So when we open our eyes, you crack open your eyes and ask yourself, where's my pain at the minute? Now in bed, or just moving out of bed, say it's a 5, or maybe you're starting with an 8. What we need to do is kind of monitor that and notice through your day when that goes up. Because what I want you to get aware of is how much you're doing that impacts the pain level. Now, we never want to make the pain go up. We always want to just do a tiny amount, whether that be 2 minutes, and stop. So it almost feels to start off with like, I'm never going to get outdone. But actually, long term, you get more done and you get control back of your life. So what we're saying is, we've got a natural point where you're monitoring your baseline. How am I feeling? You're doing an activity and you're saying, right, what's my pain like? As it starts to creep up, we're going into what we call a danger zone. So really, we've got to stop, check in, sit down for 5 minutes. What do I need? Maybe I just need to stop for a minute. Maybe I need to stop for 5 or 10. But then when you feel, yeah, I'm all right again, it's at a manageable level, then you carry on for a bit longer. And you keep stopping and starting like that. It's a bit like going back to the beginning and having to start again. Yeah, we're relearning how to be in our world. So we just normally do a task, and your brain pattern, your neural pathways in your brain are just saying, just do it. You've always done it in where you've done it, just do it. But what we're trying to do is learn something different to bypass that. So we're asking you, I'll just go through some things with you. We're asking you to consider doing it a different way. So one of the things that we go through with patients is, when you think about the type of person you might notice you've become, you might have become someone who booms and busts. So you boom and you go and you do a lot, and we're really quite overactive and we get lots done. But then we hit the pain threshold and we can't do any more. So what we're doing is we've got no energy at that point and we tend to bust. And then what we do is we have days where we can't do anything. So it's almost like what we say is, on a good day, I must do more than what I can normally, because I've got to get it all done while I can get it done. And it makes sense, there's logic in that. But in terms of your health, what your body says is, you're not listening to me. I'm going to put you out of action for the next 2 days to make you stop. So it's not a good solution. So any period of being overactive leads to too much pain. It leads to no energy, complete fatigue, absolutely cannot move. And then what it does is it stops you in your track. But the bit that comes in then is the guilt. You know, we might sit with the guilt, the self-blame, we can't be who we were, we ruminate, we wallow in depression. So that cycle of boom and bust really feeds into making you feel quite debilitated, like you can't live your life how you want to live it. So there's a longer recovery time. It's not a helpful situation to be in. So yeah, it leaves it kind of, I want to say to you, do not be active to the point of pain. So if you think about what I've just said, we do an activity and we check in and we stop. So how am I doing? 5 or 10 minutes in, how am I doing? I'm all right, my pain level's still at a 5, yeah? We do a bit more, 5 or 10 minutes, how am I doing? Right, it's creeping up to a 6. Right, stop for a minute now, have a brew, just stop, rest, and then carry on. So when you've got it down to a 5 again, then you carry on. So do you see the stop, start, stop, start? I can't stress to you enough that it is irritating because it's making you change the way you do something. But if you're active to the point of pain, we know we've done too much. That's going to put you into an unsafe zone, and it's a surefire way to lead up to a fibro flare-up, definitely. You know, it's going to put you off your feet. And it's not pacing. If you think, I've just got to complete this task, I've just got to complete task and then I'll sit, that's not pacing. We've got to just, as I said, do 5 minutes, stop, check in. You will get that pacing, you will get the task done and you'll have done it paced, yeah? Now, the thing with this, so Claire, you're definitely right, and this is why I said it's incredibly hard. You've got to bring this in to your everyday life to start off with. So you might not be able to bring this in initially to work, but what I want you to do is to bring it in where you can. Because long term, it may well be, and I totally, you know, this is so difficult, it may well be that you're in a job that don't lend for your condition. You know, and long term, it might be that, you know, at some point, I've got to get out of what I'm doing and change it, you know, but that takes time. And in the meantime, it's not always easy to be able to do that. It's not always possible. So we've got to be realistic. What I'm wanting you to do is to get your body to trust you as best you can in your own environment. Okay, that's where we're starting. And then we're going to feed it out. So when you've got a good grasp on, right, I can't just finish a job, I've got to stop and pace. When you know your own body, that's when you can go into work and you can state what you need. And actually, we're going through HR at this point, where if you think about it, it's adaptations to your job to make it work for you. It's so difficult. It's not that we can't do it, but I want you to get used to what you need to be doing in a home environment before you try and apply that anywhere else. Yeah. So you'll see, long term, I think you'll see how impactful your jobs can be on this situation. So if you are having to work in this, you'll see that actually it's not always doable, and it's going to be the thing that actually tips you so that you can't manage the condition. And if that's happening, then the employer has got to go through the correct HR channels. It's like, if you think about with disabilities, we have to help people, we have to support people to manage the condition. If your employer is not the one who's doing that, then we need to look at, well, why are they not doing that? Can I get a union involved? You know, and that's a long journey off. I think using it in your home environment is the most important starting point. But yeah, the amount of people I speak to who have the difficulty in managing work balance with this is incredible. So the other thing with this is to remind everyone that it's just going through Parliament at the minute. I'm not sure if it's come to an end yet, where they're trying to get it recognised. So do you know, for things like your sickness, if anyone's on sickness benefits and you have to have the reviews, this is becoming now a condition that is going through Parliament, basically. People are becoming aware of this condition. And it's going to the powers that be, if you like, to get it recognised. And this is what I said to you when I opened up. There's a lot of work being done behind the scenes for fibromyalgia to get it on the map, but it's a slow process. So I think we're in a better position than what we've ever been, but it is slow. It is slow to progress. So just thinking that, you know, if we're pacing to completion of a task, we're not really pacing, because if you're saying, I'll stop when I've finished, we're not pacing at all. Remember the 5 minutes check-in or the 10 minutes check-in. Don't wear yourself out. So if you think about, I'm going to do everything in the morning and then I can sit down in afternoon. If you're doing that, that's not pacing. You've got to think of it as in taking a task. I'm asking you to change the entire way you've done something all your life. So that's not easy. It's like taking a task and breaking it down. When people are well, they don't have to think this stuff through, you know? Whereas when you have a diagnosis, the thing that changes is that you have to pre-plan for everything. You have to plan ahead, and it's it's uncomfortable, and we've got to acknowledge that discomfort in that, because it's not a nice place to be having to do that. But when you get the hang of it, when you're pre-planning ahead, when you get the hang of that, you can manage your condition better. So I think we hear it a lot. There were a lady who, Christine Mazzerinano, I think her name is. Let me just try and find it for you. I don't know if anybody's looked at the spoon theory. Christine, it's on the website www.butyoudon'tlooksick.com, and I'm sure her last name's Mazzerinano or something like that, but it's Christine, and she wrote a spoon theory. So I don't know if anybody's heard of that, but the spoon theory is about pacing, and she's a lady who has lupus, which has very similar symptoms to fibromyalgia. And what she was saying is that you kind of got to go about your day as though you've got 10 spoons in your back pocket, and then 10 spoons resemble your energy levels. So how much energy have I got to apply to a task? So it might be that getting up in the morning might take 2 spoons up, just the process of getting up and getting yourself sorted. It might be that going to work uses 4, and then we've only got 5 left. So hang on a minute, what am I doing with other 5? Do you see it? In fact, we've got 4 left. What are we doing with other 4? So if you've got rest of your day to plan for, how do you spend your energy? How do you conserve your energy? And that's really important. So if you can have a little read of that, I think it'll make a lot of sense to you, in terms of, putting yourself first and how we do have to manage that. So that's the spoon theory, but it's kind of making choices that people who are well don't have to make. They don't have to do that. And that's the difficulty in it. It's almost like she talks about when you're planning ahead, it's like strategizing a war, to get from A to B sometimes. So yeah, be conscious of how many spoons you've got in your back pocket to get yourself through your day. So we know wearing yourself out in the morning is not the answer. But if you're not letting your condition in, everything that I'm saying, you're going to fight against. Okay? So we've kind of got to welcome it in a little minute and say, right, hang on a minute. It's not the whole of me. I'm not going to let it define my entire life. The more you work with it, the more you manage it, and the more it works for you. So nobody has ever got to the end of a fibromyalgia journey and said, this is how far I've taken it. But in effect, what pacing does is it reverses kind of what's happening. So whereas you're at a point where your body don't trust you at the minute, and it's saying, no, you're not listening, I'm going to give you a flare-up, what it does is it stops you going into those flare-ups. So when you listen, you're much more in control of your body, and it's helping to prevent the flare-ups. Now, when you're listening, your body will let you do a little bit more. And over time, if you keep doing that, it'll learn to trust you, and it'll keep letting you do a little bit more. So nobody knows how much that little bit more will be long term. Nobody's got to end a journey like I've just said. So we've got to keep trying, okay? Is anybody a boom and bust person? Do you notice boom and bust? Yeah, so quite a few nods. And does anybody notice that actually, are you pacing at the minute? Is anybody pacing at all? Yeah, some people are trying. So if you're pacing and you're still feeling the difficulty, I'd step it back a notch, and I'd go back to, right, let's stop a minute. So I'll just say this to you. Is anybody, I'll not ask the question, but I'll just say it. If anybody's on medication, what they usually say for fibromyalgia is the medication's not a long-term solution, because what we need to do is get lots of tools in our toolbox to be able to self-manage. So tools in your toolbox might be family time. It might be a little bit of, stretching or some kind of exercise that might help you. It might be that you look at your diet. It might be that you get a good sleep pattern going. It might be that you have lots of rest breaks in there, or even jigsaws to distract your mind, and Sudokus, crosswords, anything that's going to be a bit kind to you. Hobbies, it might be music. So within your toolbox, what we're asking you to do is not just put medication in. So for some patients, they're reliant on medication. Other patients are not. you know, and they realise that actually it's not doing a lot in terms of managing pain. And they might be putting other things in toolbox. So as I said, it could be, you know, that quality time with your friends. You might notice you've stopped going out as much because you can't do what you used to do, and you might be worried of judgment. So it's kind of just drip feeding back in when we can. Obviously with this COVID-19 situation, it's very difficult at the minute anyway to get out. But even if you've pulled away from friends, could that be a phone call at the minute, or like we're doing a Zoom meeting? Could it be something more simple like that, a conditioned time slot where we reconnect with people? Because what we're trying to do in our toolbox is put as many things in that's going to lift your mood as possible. Because when you've lifted your mood, we tend to feel better in ourselves. And if we can lift the anxiety from you, one of the things with anxiety is that when we're anxious, our body goes into fight or flight, and what it does, it releases stress hormones, and they eat away at our feel-good factors, so they put us in low mood. But they also eat away at your endorphins, and your endorphins are what control your pain. So your natural pain reserve in your body, if you're anxious, is gone, you know. So the less anxious we can get you, and the more up in mood we can get you, the better it is for your body to naturally manage its own pain levels. Does that make sense? Yeah, okie doke. So that's really important, to get you to kind of manage your own pain levels by doing other things as well. You know, it may well be that any professional is going to say to you the medication's not the answer in its own right. We've got to have other things in that toolbox. I'm just having a look if I've missed anything. Let's have a little look. One of the things that you can do to help yourself, you know, is to create a little diary for yourself. And I always think doing this in colour is really helpful. Because if you've got a diary, and what I'm meaning is a diary where you can have your days down the side and the time slots across the top. Okay, so Monday 9 till 10, 10 till 11, 11 till 12, and get a little diary for yourself. Because what that does, and you can print these online, you just want a day and time diary. What that does is, if you can just log for yourself, you know, how am I feeling? What were I doing? And what increased my pain? So you might want to write your pain level down when you get out of bed. So whatever time you get out of bed, say it's 6 o'clock or 8 o'clock, write your pain level in. And I want you to just log what you're doing in your day as to how your pain changes, you know, or how your fatigue changes. Because it's only when we do it in a diary form that we can start to see a pattern emerging. So sometimes we might think, no, I'm all right. But really there's a build-up going on of doing too much in the boom bit that leads to bust. Now, one of the things we do in the education group is we explain all this to you, and we give you the diaries so that you can try and self-manage. What we also then do is a therapy group, which is a 6-session therapy group, which then looks at how you use it. So what we do is we work with patients with everything that I've been talking about to put it all into practice, to give you a chance to use it. So, you know, that I just think it's really good if you can keep a diary, look at, if your task is a really heavy task, like say for example hoovering is quite a heavy task when you think about it. It might not have been before, you might rate it as not being, but when you think about the reality of it right now, hoovering is heavy. You know, if we have any operation, hoovering is one of the things we can't do for at least 6 weeks. So look at it like that. Now if you think about your fibromyalgia, what's going to trigger a flare up? What's going to trigger your pain? And it might be that we have to adapt how we're doing something. So hoovering, for example, you might hoover a couple of strips on your carpet and stop for a couple of minutes. Sit, just stop. Hoover again for a couple of minutes more. Stop. Hoover again for a couple of minutes more. It's probably going to take you 10 minutes to hoover a room as opposed to 5. But by the time you get to the end of it, you're going to be fine. You're going to be able to carry on and do the next task. So do you see what I mean by we've got to just adapt what we're doing and how we're doing it? Just bear with me, I've just lost you all. Can you still hear me?
Yeah, we can still hear you.
Just bear with me, my screen's just off.
Don't worry.
Oh.
We still have you anyway. We can still see you.
Right.
We can hear you.
That's fine. It's come back on.
Oh, good.
Yeah, so if you can just imagine the way I'm asking you to do it, you're kind of going to be going, oh my gosh, I can't go through my life doing this. But what I promise you is that the more you do this, the more you'll get used to it and the more your body will allow you to do. So whereas I'm saying do 2 strips at over and stop, or do a couple of minutes and stop, eventually you'll be able to do 4 minutes and then stop and check in. Eventually you'll be able to do 6 minutes and stop and check in. So what we're trying to do is go back to the very basics, back to the beginning, to actually help your body to relearn that actually I need to just relearn my my pacing, you know. Actually, can I go back to the beginning and start at my baseline and work myself back up to a manageable level, rather than, as I said earlier, the neural pathways that just make you want to do it how you used to do it. And you'd be quick to go back to your neural pathways. You'll think about going into Doncaster. We always go the same way we normally go. God forbid there's roadworks, because then we have to think about how we're going to do it. And this is what your brain's up against, because it's just wanting to do what it's always done. And you're in a position where I need to stop and I need to find a different way to do it. So I think keeping a diary would definitely help you. And it's deciding what will be high energy tasks and how much does that impact on my pain. So it might be, you know, heavy ironing even is a heavy task. You know, there's a lot of vigorous movement in ironing. It could be that gardening's a heavy task. It could be lifting children up. You know, when we pick them up and we think nothing of it, that's difficult because we've got to manage how we're going to do it. Making a bed, you know, the amount of energy that has to go into making a bed is phenomenal. You know, when you're with a long-term health condition and you have to actually do that, people don't realise what you're experiencing, and they can't possibly, because they've not got what you've got, or they've not got it how you've got it. You know, so it's hard. Think about what would be a lesser task, like combing your hair. If you've got pain in your arms, combing your hair on that day might be something that takes you 5 minutes to get hair. But then I want you to stop and have 5 minutes break, because at that point, to pace it, you need to kind of take your time to do it, to pace it, to get to the end of it. Stop, breathe, rest. How am I doing? And then carry on. The biggest thing in this is, are you kind to yourself? How many of you are not kind to yourself? So we put everyone else first. They're all at top of your tree and you're at the bottom. How many of you would agree with that? It's like having a cake and giving all your slices away and you're the crumbs. And by the time we've done, there's nothing left for us. And I would say to you, there's a sadness in that there's a low self-esteem in that. Yeah, it's almost like we're not worthy of giving our time or effort and energy to ourselves. But what I want to say to you is, you are the most important person in that room, and you've got to put yourself first right now, which is an alien concept to some of you. So you've got to look at, right, if I've got to put myself first and be top of the tree, that's the way that I'm going to be able to then be the person I want to be and look after everyone else. Because if you can't put yourself first, you're not going to have the energy and the reserves for everyone else. So again, I'm not underestimating what I'm saying to you. It's a hard journey, this, but it is a journey that you can do, and we're here to support you. You know, and groups like what, you know, you're in at the minute are so important to validate your experience, because it matters. It matters what you're going through. You know, if we've got somebody with diabetes, they're accepted in society instantly, because everybody knows diabetes. It comes under a medical model. It's like having a respiratory problem like COPD. Everybody just accepts it. But when you think of fibromyalgia, the difference is it's not fitting firmly in a medical model. It's fitting in a biopsychosocial model. So it's taking into account everything else that's going off around you. So there's so much to consider, even in, you know, your physical well-being, your mental well-being, how this impacts your coping skills, socially. Have you got the support around you? Have you got the support in your job? Everything matters, you know. So it's not just when we have a medical model, we might have something wrong, like the diabetes. We go and see the diabetic nurse. She tells us what insulin we need. We do it, and that's the fix, or that we'd hope would be the fix. This is very different. There's so many aspects to it in a biopsychosocial model that we have to take into account. But the other thing to consider in this is that we've got involved in this through IAPT long-term conditions purely because we cannot underestimate the psychological impact that it brings, but also quite often patients who get fibromyalgia tend to be very caring people who've always been at the bottom of their tree, who have always put others first, who have always valued everyone else's worth more than their own. And you might have had experiences of loss, multiple loss, relationship breakdowns, be the person who's always supported everyone else. And this tends to be a theme within patients, that you are the type of person who will put yourself last. Yeah. So there does tend to be, in terms of understanding causes, there tends to be an emotional element to this where you don't tend to process the emotions and then it plays its way out of your body, a little bit like that eczema one I said earlier. So from a mental health point of view, if we can help you to unravel some of those emotions, that will have a positive impact on your body. And when you think about pain comes from the emotional side of your brain, it's really important that we work on your emotions because that might settle some pain, you know. So really we're coming at it from all angles to try and give you the best way of managing this condition. And as I said to you, I've said it twice, no one knows where they can go to on this journey as to how far they can get down the recovery route, because nobody's ever come back to us and said, this is where we've, you know, this is what we've done. And I think that's because it's only just really starting to be recognised in society and accepted. You know, some of you might still be battling to get it accepted, as I said earlier. So I hope that gives you a bit of hope in terms of, you know, support's out there. We're there, we're definitely there to work with you. It is me who runs the group. We're another lady, an occupational therapist. So we're here as a team to support you. But I suppose the thing is, it's deciding when the time's right for you. You know, so my background is counsellor and I work with a lot of loss. So over my time, I've worked with everything, but also with, I trained, you know, working with lots of different types of loss. And this is a loss of health. But as I said, we can recover some of that. It's not like it's an illness that we can't work with. Actually, this is one that we can make some positive changes in to better manage it. You know, so you're up against it, but we're here to support you. And actually, there is a road to working towards a better recovery process, really, you know, but not easy. I hope that's helped. Is there any questions? No?
No, no questions, Kerry. I think you've covered everything.
Oh, bless you. Well, I do hope it's helped.
Yeah, it's been really insightful, even for people who, at this moment in time, who maybe aren't struggling with chronic pain and fibromyalgia. The pacing of things, because everybody's anxiety levels are through the roof at the minute. So that pacing for anyone right now will help, because then obviously you're anxious, you get more fatigue, and that, so it's really useful for a lot of people. That, so thank you ever so much.
Oh, you're welcome.
Thank you so much. Before we finish, are there any last comments or any questions?
Oh, you're welcome, Claire. You're welcome. But if you need anything, you know where we are. Yeah.
The number again for IAPT, it's 01302 566 999.
Yeah, that'll get you to refer in. Yeah. And what you can do from that is, you know, self-refer. You don't need to go through your GP. Self-refer, and we can help you from that.
Yeah, I don't know if Claire might have heard this before from other members of the Bentley group who have been, and they've done the IAPT services and the different things that Kerry mentioned before, and all the feedback's always been so positive, and how
that's brilliant.
Manage the condition. So we really would encourage everyone to do it.
Oh, bless you. That's fantastic. If you need me to speak again, just let me know. And if there's a different area we need to look at, that's absolutely fine.
Yeah, definitely. I think Julie's just put her hand up.
the number online so that I can get it? Or
Is the number online? The number is online, yeah, for our services. Yeah.
Next week,
It's the same number as the crisis team. When you get through, you've not got to the wrong place. What happens is they look at what you're coming through with, and then they filter you to the right place. So it's like a central number to get you where you need to be.
Great, thank you. Next week, we've got a session on mindfulness. So it might give you some hints and tips of how to, if you are feeling stressed, if you are having more flare-ups than often, having that a bit of insight into mindfulness might help you.
You mean in 2 weeks' time?
In 2 weeks' time, I've said it again. I do it every in 2 weeks' time. Thank you, Claire. I did that last fortnight as well. So yeah, in 2 weeks' time, we've got someone coming in to speak about mindfulness. But until then, if you have got any questions for Kerry, please just email the Well Doncaster email, which is welldoncaster@doncaster.gov.uk. Or if you've already got one of the officers, so myself or Marianne's email, you're more than welcome to drop us a message and we can pass some questions on to Kerry if you have any. So,
the other thing I was just going to say then is we do the mindfulness as well, you know, and we do filter that through treatment. So if you want any more on that when you've had that session, just let us know, and it might be we can add to that for you.
Amazing, that's great to know. Thank you, Kerry.
You're welcome.
Thank you very much everyone for joining.